It's been nearly 5 years since the COVID-19 pandemic turned the lives upside down globally, with the latest COVID-19 deaths now exceeding 3.4 million. Now, China is grappling with a new outbreak of the human metapneumovirus, that is, the HMPV virus. According to reports, the surge in HMPV cases is concerningly very high. Social media posts and reports suggest that the outbreak is putting the hospitals and crematories under immense pressure. The virus is spreading rapidly with allegations of overwhelmed and overcrowded hospitals. Social media users claim that there is a surge in multiple viruses. It includes influenza A, HMPV, mycoplasma pneumoniae, and COVID-19, all circulating simultaneously. However, there has been no official confirmation from the World Health Organization nor from the Chinese government. The situation in China has sparked panic online. Hello and welcome. This is Akanksha and you are watching HW News English. Let's start to understand everything in detail about this HMPV virus. What are the symptoms and the preventive measures, and should India be worried? Let's get right into it. Multiple videos circulating on social media claimed that the Chinese hospitals are overcrowded with patients suffering from multiple respiratory illness. Some online users even allege that China has declared a state of emergency due to the rising HMPV cases. Have a look to this video. While HW News English cannot independently verify the authenticity of these videos, according to reports from the Chinese Center of Disease Control and Prevention, northern China has been identified as the most affected region. The pediatric hospitals are overwhelmed with cases of pneumonia and white lung conditions in the children. However, these claims have not been officially verified, yet they have added to public anxiety and a COVID-like situation worry. Now let's try to understand what is the HMPV virus and is it similar to the COVID-19. The human metapneumovirus belongs to the Pneumoviridae family. It was first identified in 2001 by some Dutch researchers. Studies even suggest that the virus has been present for over 6 decades, making it a most common respiratory pathogen worldwide. The human metapneumovirus is a virus that usually causes symptoms similar to common cold. It often causes upper respiratory infections, but it can also sometimes cause lower respiratory infections like pneumonia and asthma flare-ups or make chronic obstructive pulmonary diseases worse. The HMPV infections are most common in winter and early spring. According to reports, most people get HMPV before they turn 5. You can also get HMPV again, but the symptoms are usually mild after your first infection. Researchers estimate that 10 to 12% of the respiratory illness in children are caused by HMPV. Most cases are mild, but about 5 to 16% of children will develop a lower respiratory tract infection, like pneumonia. The primary targets of this virus are believed to be small children and the elderly. Young children with developing immune system are particularly vulnerable, while adults over 65 and people with breathing problems or a weakened immune system may also get severe symptoms. Meanwhile, the surge in HMPV outbreak has drawn comparisons to the COVID-19. This is because both have similar respiratory symptoms such as cough, fever, and shortness of breath. According to a study published in the Virology Journal in April 2024, after COVID-19, the cases of HMPV increased in Henan, China. The HMPV infections were almost detected and hospitalized every day between April 29 and June 5, 2023, the study revealed. It also suggests a potential link between two virus resurgence and patterns. What are the symptoms of HMPV? The symptoms of HMPV often resemble common cold, cough, fever, runny or stuffy nose, sore throat, wheezing, shortness of breath, rashes on the body. In severe cases, the virus can also lead to bronchitis, pneumonia, or worsening of chronic obstructive pulmonary disease. Now let's take a look at the preventive measures. Covering the mouth while sneezing and coughing. Washing hands frequently and correctly with water and soap. Avoid sharing cups and eating utensils with others. Now, is there any vaccine for HMPV? Well, no vaccine or specific antiviral treatment exists for HMPV. Despite being discovered for over 20 years, there is no vaccine for HMPV as of now. Most of the affected individuals can manage their symptoms at home until recovery. However, if symptoms are severe, hospitalization must be required for closer monitoring to prevent further complications. How is HMPV transmitted? The HMPV spreads through direct contact with someone who has it from touching things or contaminated with the virus. For instance, coughing and sneezing, shaking hands, hugging, kissing or touching surfaces or objects like phone, door handles, keyboards or toys. How is the human metapneumovirus diagnosed? The HMPV virus can be diagnosed based on your symptoms and health history. Doctors use a soft dipstick to get the sample from your nose or throat and get it tested. In severe cases, you might be also asked to perform a bronchoscopy or a chest X-ray to look into the changes and airways of your lungs. Now, should India, being the neighboring country to China, be worried? Well, the reports are concerning as China is battling with the outbreak and other Asian countries are also reporting respiratory illness cases. Influenza is on the rise across Japan, with the weekly case counts increasing in all 47 prefectures. As of December 22, 2024, 211,049 flu patients were reported in 5,000 hospitals and clinics across the country in just 7 days. The total number of cases in the country for the current season has reached to 718,000. The data from Hong Kong Center of Health Protection revealed that the infection rate for HMPV was 0.72% between December 14 and 21, slightly up from the previous week but still low from the last year's figures. Despite the reassuring trend, the health officials remain vigilant as the flu season approaches. However, the flu infection rates in Hong Kong are already on the rise. The CHP reported a flu infection rate of 1.35% between December 14 and 21, up from 1.09 the previous week. Well, even after 5 years, the fragility of the global healthcare system is still recovering from the COVID-19. As of now, the healthcare authorities in China are monitoring the outbreak very closely. Many campaigns and initiatives are being held in China to make people aware of the symptoms and take preventive measures to mitigate the risks. Well, that's all for this news report. Till then, keep watching HW News English and also download our app HW News Shorts for the latest news and updates.
Stay ahead with our cutting-edge news app. Instantly access the latest shorts in just 1 minute and breaking news in just 50 words. Download now for a smarter, faster news experience.